It's 7 o'clock, so we're going to go ahead and get started with our Facebook Live. Joining me this evening is Dr. Kip Anderson and Dr. Luke Lemke. I asked these gentlemen, number one, because they're very well respected in our community, but number two, they're Columbus High graduates, so they're alumni of Columbus High School. So, gentlemen, docs, thanks for joining me tonight.
Thanks for having us.
Yeah, so before I get into this evening, we have about 15, 16 slides we want to share with the community, but I want to give Dr. Anderson and Dr. Lemke an opportunity to talk to the community, kind of what they're seeing in their practices, what they see statewide maybe, and then any other kind of concerns or observations that they may have. So why don't we go alphabetical? So that'd be Dr. Anderson.
Okay, well, I'd like to just share something that one of my colleagues from the Academy of Family Medicine forwarded. It was released from the CDC sometime this week in their monthly mortality report. It was kind of I thought it was really an interesting study regarding at least the use of masks. There was a case, I think it was in Springfield, Massachusetts, where a hairdresser went to work sick, basically, wearing a mask and infected one of their coworkers. So there were basically, for about a 5-day period, 2 sick with COVID hairdressers wearing masks, with all of their clients also being masked. And they traced 139 people that they came in contact with, and not a single one of the people that were in getting their haircut by either of these 2 individuals ended up getting sick. So while there's been a lot of debate about the use of masks and whether they're effective, I mean, this is just a case study, but boy, I look at that as really encouraging evidence that that the masks are going to be effective, and hopefully we'll keep our kids safe at school.
All right, thanks, Dr. Anderson. Dr. Lemke?
Yeah, thanks. So appreciate the opportunity tonight. Kip and I talked earlier, and I think we all agree that we really appreciate what the schools have been doing in our area. I think the strategies that have been laid forth, I think, are very proactive and very much in line with what I think the medical community and our hospital has been, really looking at for a long time. I mean, I think, Kip would agree. We've been doing this for, it seems like years, but I think we started the 1st of March, and with some pretty intensive things. We all came out of the chute, going very quickly. And then we realized that we probably hadn't seen our wave come to Columbus, Nebraska. And I guess if we look back, and it'd be nice to have that retrospective scope, we could say we probably started a little early in that process, but I think it gave us good practice. Now, the downside of that is I think people are sometimes a little bit, they're kind of getting tired of it. They're wearing down a little bit. And of course, we had that huge upswing with the meatpacking industry, and it gave us a great opportunity to kind of hone our skills a little bit on how we handle the positives, what that looks like, making sure that everybody in the community feels like they're getting a response and getting cared for. So, if that in fact happens in the wintertime months, I think we'll have a very good, framework set up as to how to really handle those people that are in fact positive. So, and I think what we're seeing in our community right now is still, some pockets of some positivity. There's still a few events that have triggered that, and it does kind of bring back the infectious rate of this, as Kip alluded to. If there's some simple factors that go into that, it's obviously distance, time, 15 minutes, less than 6 feet, and both parties unmasked. And so if that's the case, then those are all high risk situations, and in fact this virus will most likely affect those people. So we're seeing that in these pockets. But if, as you said, if people keep their distance, and they're masked up, the potential infectious rate goes dramatically down. And so it's just amazing how those simple things that we've been talking about for so long are really starting to show forth, even in our community. It's one thing to look at New York and Texas and all those, but classic examples here in our community where we see that happening as well too. So I'm starting to see a few more cases coming back positive again. And unfortunately, the testing only occurs usually when somebody's positive, and by that time, We know that they're have been shedding the virus for several days ahead of time, and they're probably on their way down as far as the amount of virus or the viral load shortly thereafter. So I think there again, the difference between this virus than any other virus is it's the amount of contagiousness prior to their showing symptoms, as opposed to the influenza, the Spanish flu of 1918, all of those different places. They really didn't have that a degree of infectiousness before the people showed symptoms or even in the asymptomatic. And that's why these universal policies, we just can't let down our guard when school opens, because those are the reasons why this is such a widespread problem across the country, and not only there, but right here in Columbus, Nebraska.
All right, gentlemen, thank you. Anything else, Dr. Anderson? Anything follow up from Dr. Lemke before we get started?
No, I totally agree. We're basically seeing the same things, and I think our community as a whole should be applauded for what it's done so far, and we need to just, like Luke said, keep our guard up.
All right, very good.
I want to add one more thing, and I'm going to show a shout out. East Central Health, I have to applaud. They've been burdened with a lot. They've done a wonderful job, and I'm going to throw a shout out to Dr. Klutman. God rest his soul. He worked diligently to get one of the best health systems, public health, in our area, and it's paying benefit now in a lot of ways. I think we've done a great job of doing some things through East Central that can't go unnoticed.
I would agree with that. We've been engaged with East Central District Health since February 27th, our first meeting regarding COVID-19, and that's when it was just really hitting the East Coast. And they did a great job with our community hospital, the doctors. I know all 3 schools in the area were engaged in a conversation long before we even had our first positive case. And so it's been a long time since February 27th. And like you said, it seems like it's been a year since we went on spring break on March 9th. So it's been a long time since our students have been in school. And so tonight we want to kind of share with the community the plan that we have to bring our students and staff in safely. Today was the first day back for all of our teachers. Our new teachers came in on Monday. Excited to be back, cautious at the same time. And I know that they're going to do the right things to protect themselves and their students and make sure that we have a healthy start to our school year. So with that, I'm going to share my screen. And I hope everybody in Facebook Live sees this. So on our return to school plan, first thing I want to do is shout out to our committee. This isn't Dr. Troy Loeffelholz's plan by any stretch of the imagination. We have had several of our staff members engaged in conversation since June. So as soon as school was supposed to get out on May 21st, we had over 100 staff members working in teams and committees to develop the best plan going forward as we move into the fall semester. And they put together some great recommendations, not only for health and safety, but social, emotional, transportation, activities, you name it. They've covered every base, and we're going to talk about some of those things tonight. And I know parents have some questions about some other pieces, and we're going to try to get to those, but bear with us, okay? Facebook Live etiquette, we just ask that please post all your questions in the chat. And we have somebody on staff here in the office who's going to copy all those questions down, put it in a Google document. Then I'll read the questions, and either myself or Dr. Anderson or Dr. Lemke will answer the questions. And all questions will be answered at the end of the presentation. We ask that you be nice to one another. Do not direct comments to others through chat. This is a time to receive information and not politicize something as important as our kids. So both doctors talked about East Central District Health Department, and again, Chuck Sieper and his team there have done a great job of helping us and guiding us from things like graduation and prom and summer sports activities, et cetera. But we are following and using the guidance of the 4-tier system on the risk assessment dial, where green is no to low risk, tier 1, tier 2, moderate risk, tier 3, high risk. And tier 4 is something like we saw back in the spring when we released school. right after spring break and went to remote learning at home. So right now, as of last Friday, Platte County is in the moderate, so the tier 2. So the plan that we sent out to home to parents and people in the community is based upon opening school under yellow, tier 2. And so the difference between green and yellow for us as a school district is the wearing of masks for students. So we are requiring masks for students and staff in yellow, orange, and red. And some extra precautions come with that when we move into the orange and the red. But in green, you may see the district say, masks are highly recommended, but all of our staff will be required to wear the masks. Again, bro, yes.
Can I just, can I go back to that just real quick?
Sure.
Just so people know what goes into those colors real quickly. I think there's 4 major things that go in there. One is daily new cases. The second is infection rate. The third is positive test rate. And the fourth is what we call ICU headroom. And those, I think 4 factors go into what those colors mean. And so that's, I think, on the East Central website. If not, there's a website called COVID Act Now that also breaks it down by county as well. So that's what goes into those 4 different colors.
Well, thank you very much. That's great information. We get involved with it so much and talk about it so much, we forget about the details. And I think that's good information for our community to have, because there is more to it than just somebody making a determination. So a lot of data and a lot of statistics with that. So we are opening school. Again, we moved our school year back basically almost 2 weeks to August 24th to buy some time for our teaching staff to prepare for the upcoming year, and also hopefully to buy time to see what the virus is doing within our community and how we respond to it. So we're opening in tier 2 yellow, and that's the plan that was sent home. We delayed school for number 1, to prepare for the upcoming school year, but also to prepare for tier 3 orange. And so if the risk dial gets to orange, where we're seeing a lot of community spread, we may be visiting with the doctors, we may be visiting with East Central District Health Department, Health and Human Services, or the governor or the commissioner of education, and taking all that data in, and we may have to go to orange. And orange would be a every other day scenario for our students, and so that plan will come out at a later date. We didn't want to inundate parents and students with something at this point in time. Again, we're going to open in yellow, but orange will be ready to go, and we'll talk more about that here in a little bit. The risk dial assessment is not the end-all to end-all. So just because Platte County may be in the orange doesn't mean CPS may be in the red due to staff availability. So with this virus, we know that substitutes are a challenge anyway in a normal year, but we have a lot of substitutes who may not, for various reasons, health reasons, age, may not want to come in and substitute in our classrooms, and so our substitute availability is low. And if we have a lot of staff members, and when I say a lot, only up to 10% of our staff, if they are gone, that's 40 to 50 people. And it's hard to hold school with no substitutes and 40 to 50 of our staff members gone. So you may see some differences with the risk assessment to what we're doing as a school district. And shutdowns may be by building to building, could be classroom to classroom. We'll cross that bridge when the opportunity presents itself and the data we have is at hand. What we're asking parents to do is do some screening at home. So take temperature at home. If over 100.4, contact your healthcare provider or East Central District Health for guidance. Some questions. I think we all have seen these questions several times, but we just need to keep in the back of our head as we plan trips, maybe for a fall break or a Christmas break, because we don't know when that vaccine is going to be available to any of us. And so as we make plans going into the school year, we strongly encourage people to stay within the United States, preferably stay away from some of those states where you're seeing a high level of positive test results. But and really highly encourage people to stay within the state for that matter. And have you been in contact with anyone who's tested positive for COVID-19 or shown COVID-19 symptoms in the past 14 days? And if you have, again, we ask you to stay home. And do you have any of these symptoms that are not caused by another condition? Now, I know, and I'm gonna let the doctors talk here a little bit. A lot of these symptoms are also related to the flu. They're related to allergies, hay fever, and you know what we've told our staff and some of our other people in the community who work with us is everybody kind of knows their body and they know when something's not right, and you need to listen to your body and you need to listen to the signs that it's giving you. But if there's fever, chills, cough, shortness of breath, or fatigue, muscle or body aches, headaches, we ask that you go home or stay home in the morning. Don't send your child with a sore throat. If the sore throat persists for more than 24 hours, we strongly encourage you contact your healthcare provider. So Dr. Anderson, Dr. Lemke, anything you'd like to add to this screen?
I would just encourage parents to probably have a little bit lower threshold for keeping your kids home in light of all this. I was one of those kids that I think missed one day of school in 12 years for being sick, and probably had days when I shouldn't have been there. And if you've got one of those kids, you may need to lay down the law a little bit with them. And then I would also say, you know, we always encourage influenza vaccines. I think this year it's going to be incredibly more important because the more we can mitigate that disease going around to reduce the risk of somebody getting both infections at the same time, or just confusing the whole picture of things, it'll be helpful for not only your children, your family, but also for the community at large.
I 100% agree. A couple things I'd add, I guess, is as well with the outside the United States. I think with the United States still being on the probably the greatest increase, other than a few places in South America, I think traveling to those hot spots still, California, Texas, Florida, probably even as much risk or more than traveling outside of the United States. And then on point B there, yeah, we have to be, I agree, kind of have a lot lower threshold to people that have COVID-like symptoms down below. You know, unfortunately, the testing is taking longer than what we would like. It may take 2, may take 4, may take 5 days. So while we're waiting for that test to come back, we need to have people, quarantining for sure. But if they've been exposed to somebody who has very classic symptoms for COVID-19, while that person is waiting to get tested, it really would help to mitigate, to have people, contact their physician, get their information. We're hopeful that testing strategies that are much more rapid, less than an hour, that are more hopefully close to being sensitive, will be really, really helpful this winter. And I'm really hopeful that those will be available soon. So that would help. Somebody could go get tested and have a pretty good idea of whether they have it or not.
All right, very good. Thanks, gentlemen. Remote learning. We talked about the different pieces. I know this is kind of one of those hot topics for some families regarding the remote learning and why we're not offering that. And we are offering it to certain student populations. So if we have students with medically documented health issues or underlying health conditions, or students who have family members living in the home with underlying health conditions or medically documented health issues, there's a form that you can get from Mr. Harris, Jason Harris, and there's his email address, and we encourage you to contact him so we can develop a plan. Now, we are going to ask that you have some medical documentation for that, so we can just see how many students this does involve as far as remote learning. Like I said, we don't have the manpower or the wherewithal to offer a complete separate remote learning along with a face-to-face instructional plan. But we're going to meet the needs of those students who do have those health issues and those student families who may have somebody with a health issue at home.
Troy, I would add, I think this is a unique, this is a whole unique situation in looking at that slide. And Kip and I were visiting about a guy named Bob Rauner, who's in Lincoln, who's on the school board in Lincoln. I'm sure you're familiar, but the conundrum of this is that we were asking the students to protect us. because I think one thing we didn't mention in the earlier stages that is true, that the documented cases of kids under the age of 17 getting serious complications or even dying from COVID-19 in Nebraska is extremely remote. In fact, I think he quotes only one case of somebody that had multiple conditions. So while it is true that children, for different reasons, don't seem to be as affected severely because they seem not to have this ACE2 receptor. They may not have the inflammation that we all, as older folks, developed. They may not have the lung capacity. They may not get the serious cases. I think there's good documented evidence that those kids are still very good transmitters. They're still very good hosts for the virus. Nothing prevents that, except maybe under the age of 5, they may not even carry the virus. But all of this is, we're really doing all of this mitigation, yes, to protect the kids, but most importantly, to protect those members in the community that are at higher risk. It is the ultimate, altruistic sacrifice that we can make to make sure that we're protecting those most vulnerable in our community. And that's really what we're asking the kids to do in this situation, is protect the rest of us.
Very good. Dr. Anderson, anything you'd add to that?
Nope, I agree.
Okay. A question came up regarding homeschool, and I know some of our parents are choosing that option to keep their children home from school. Just remind you that if you are going to homeschool your students, you have to apply for homeschool on the Department of Education website. It has to be passed by the State Board of Education to do so. However, we just want people to have the right information that the question is there a state diploma for exempt school students? And the state of Nebraska does not issue a high school diploma to exempt school students. And homeschool students are by definition at the state level called exempt students. In some cases, the exempt school creates a diploma. NDE does not collect or certify those diplomas. So for our purposes, if you have a high schooler who you decide to homeschool, please understand that you have to enroll them in some kind of online high school that is accredited. And when I mean accredited, advanced ed, there's a couple other accreditation organizations that accredit high schools. And we require that for our transfer, because part of our Rule 10 with the Department of Education is our students have to meet the criteria of so many English classes, social studies, science, math, and electives. And so when students come back in, they have to transfer those accredited credits to our school district to count towards graduation. I don't want some families to keep their children home for a semester, not earn any credits, and then come back as a sophomore. You'd come back in the spring as a first semester sophomore, so you'd lose half a year of credits. So we just want parents to understand that. And we're not going to stop anybody or talk anybody out of it, but I think people just need to understand how the credit system works and how the transfer credits work with high schools across the state of Nebraska. And again, right here, we said we'd provide some information. There's no such list of recommended online high schools that we can provide. NDE cannot endorse or recommend any of them, but there's a website down here. And again, this program will be posted on our social media and our website. But the University of Nebraska High School is an accredited system for high school students who want to do remote learning or online learning. University of Indiana has that same setup, as does Brigham Young University and the University of Missouri High School. These are all in the top 50. They're accredited through Advanced Ed, which we're accredited through. And believe it or not, that's a reasonable cost for some of these accredited high schools online. But the link is there where you can search for some others. And again, if you have a high school student that wants to come back second semester, say there's a vaccine, or even next year, we want to make sure that we keep them with their class and they can graduate with their class. If they come in with no accredited credits, it is going to set them back. So you heard the doctors talk about masks being required. All students will receive a minimum of 2 masks. I would say 2 to 5 masks are probably going to be available to them. They're going to be a couple cloth masks, and then through our educational service unit, there's some other reusable masks. And so I don't know if you can see, so this would be one cloth mask that students will receive. There's a black one, a maroon one, and then we have a gray one, and then more of these flimsy, probably, I don't even know what you want to call them, but these are the ones that came through our educational service unit. A lot of people wear them around the community. They're washable, wearable. All these are washable and wearable. So our students will receive anywhere between 2 and 5 masks to use throughout the week. And as what was sent in the publication, it talks about, I think Dr. Anderson talked about, when 2 people are masked up, it's a very low, there's a very low possibility, a probability of transmission. And that's what we're trying to do. And Dr. Lemke talked about, our young people, yes, they may be asymptomatic, or they may not carry the virus or have severe reactions to the virus, but we are protecting everybody and not just the students. Doctors, would you add anything to that slide?
I don't think so.
I love the 3 reasons I wear a mask. I think that capsulizes it right there.
Okay, thank you. All right. Again, I talked about this, but students can provide their own masks. We're not saying you have to wear ours. I know a lot of people have been buying masks over the summer, designer masks, Vera Bradley or Adidas or Nike. I mean, I think Under Armour even sells them now. They can wear their own masks, but it must meet the dress code just like everything else. Designs must be appropriate, cartoon characters, etc. Can't wear them if there's inappropriate language or signs or drug-related items. That's not okay. So just like what we would do with a t-shirt, we're asking you to be appropriate with your masks. We will provide mask breaks, and there will be mask breaks at recess. This will be decided at the building level on when and how that will work. I know they're working like I said, our teachers just came back today. I know there were some questions about, can we see a classroom? I would have loved to have been able to show you a picture of a classroom and how we're going to do some social distancing. But with everybody in the mask, we can reduce that 6 feet a little bit for the number of children who are in our room. We're not sharing supplies in our classrooms. So getting back to the mask breaks and recess and all those other protocols, those will be developed by the building principal, because not all buildings are created the same or have the same needs or are able to do the same things. And so they will communicate with you through their correspondence before school starts on how they're going to handle these situations. Sanitation, as students enter the room, sanitizer solution is sprayed by the teacher or para. We're asking only the staff to handle these containers. We're trying to, like I said, mitigate the amount of contact on the surfaces with the sanitation bottles. Students leave their area, they'll wipe down their desk, chair, and any other shared materials. If there is shared materials, there will be 2 health offices in all schools, one for sick children, and then one for routine business like medication distribution. And I will say, if a student comes to school with a sore throat or a cough, we're probably going to call you right away to come get them. We're not going to wait for an hour to see if things subside. We're going to ask you to take them home. If they're running a fever, obviously they've got to be fever-free for over 24 hours to return. So just know that if you bring your child sick, or if they have cough medicine in the morning and they don't cough for a couple hours, but they start coughing around lunchtime, we're probably going to call you to come get them. Meals and drinking fountains. Breakfast will be served at 7:30 a.m. Students won't be allowed in the building until 7:25, and they'll go straight to the cafeteria. Menus will be provided as they have been in the past through the newsletters and the school websites. Students may, and this was one of the confusing things on the handout that was meant for vendors and not from people from home on lunch delivery. Students may bring lunch from home. We never want to take that away, because we know children have their favorite sandwich or their favorite Lunchable or whatever it happens to be, and we want them we want food in their stomachs for the rest of the day. We don't want any child to go hungry by any stretch of the imagination. So yeah, they can bring lunch from home. If a student forgets their lunch, We ask that it be dropped off by 9 a.m. and placed in the vestibule with the name, grade, and homeroom teacher clearly marked on it. That way we know where to get it, and we can let it set for a while before our people actually handle the bags. Menus just like breakfast will be handled like they have in the past. One new thing this year is you're going to be able to do online lunch payments. That'll be available soon, and more information will be coming out. So you'll be able to pay your lunch for your child's lunches through our website. Drinking fountains will be out of service. We'll have all of them shut down. However, we have the touchless water bottle filling stations in all of our, well, we have them in our high school and middle school. We have several spread out through those 2 buildings. And as we speak, the touchless water bottle filling stations are being delivered to all of our elementary schools to be installed before kids show up. Again, trying to mitigate the amount of contact on surfaces. Question, where will my student eat? Again, this is one of the protocols through the buildings and the building principal and his team of teachers. Those locations will be determined there. I do know that there'll be assigned seating in case there is an outbreak or contact of a contact or a positive result. At least we can contact trace who sat in those seats. And again, they're going to be disinfected when they leave, but at least then we can contact parents to let them know that this has happened. My guess is one of the plans I heard at the elementary was say 2nd grade goes down, there's 3 2nd grade classrooms. 2 of them will eat in the cafeteria, 1 will eat in their classroom, and then they'll rotate those throughout the week. So each week they'll eat in their classroom at least once, maybe twice. Portion sizes will be the same. It's not going to be when we say grab and go. I don't like that name. We need to change that, because that, to me, that gives the visual of a bologna sandwich and a Ziploc baggie of potato chips, and that's not what it is. If you had any of the lunches over the summer, their summer lunch program, you know that there were some hot sandwiches in there. Our kitchen staff does an amazing job. They're very creative, and there will be options for our children. The only thing we won't be able to do is the open fruit and salad bar, but the vegetables and fruit will be included in the meals that they're receiving every day. Communication, I went too far. Again, we're going to be talking to families and sending messages through mail. We know parents like text messages the most through our surveys. And so our ThrillShare is a software program. For you, it'll come to you via your cell phone or your email. Wordware is our food service. That's where you'll be able to pay your lunch balances and put money in your accounts for your students. Parent View, we are no longer using PowerSchool. We're using a student information system software called Synergy. And so instead of having PowerSchool for the parents, it's called Parent View, and that information will be coming home to you via the school mail from your buildings. And then Remind. We strongly encourage you, and I'm going to give you some codes here in a second. I do have a staff notification, then I have a community notification. So if there's any news or any emails or any posts, I usually send out a quick blurb through Remind. So I encourage you to join Dr. Loeffelholz's Remind. This is where I get for a snow day or any type of closure, this is the fastest way I can get it to the most amount of people. So I'm going to give you that information here in a second. If we go to remote learning, high school and middle school, the main mode of communication for students and their work will be Google Classroom. Preschool through 4th grade, the main mode for instruction and interaction with the classroom teacher will be Seesaw. And as soon as our students show up in the building, they'll be learning and most of them know how to use some of these programs already, but it'll also be some information coming home to parents so they can help monitor their children on these software packages and make sure that the work's getting done and they're engaged with the teacher in the process. So if you want a text from me on any closure or any important information, for example, we have a surge in positive COVID results, And we have been in conversations with the doctors or East Central, or maybe the governor puts in a state of an emergency and closes schools. We can get the message out right away. So if you just text 81010 and then at CPS schools, that'll join my emergency notification, and then I will accept it, and you will be in the group. If you like going through the app, again, this will be posted. If you have a smartphone, you want to get push notifications, then again, you can, through the app, you can do it at rmd.at/CPS schools. And again, the smartphones, text communications. Again, I think parents really like the text and email more than phone calls and the robocalls and all those other pieces. Plus, I know in a lot of these programs now, they can translate themselves into Spanish and French. I know, especially in Thrill Share, so you can receive that in your native language. All right, that is it for the presentation. And one thing I just kind of want to share with everyone. People ask questions about what kind of sanitation solutions are you using, and we talk about gel-based sanitizer in all of our classrooms with 70% alcohol. And again, this will be on the website and on our Facebook Live, and it gives all the different ingredients and the chemicals within each one of those. And this is the same handout we get, so you're getting the same information that we have on each one of these pieces, each one of these sanitizers. And then the stuff we use to sanitize surfaces, all that's going to be posted up there, from the Neutron Neutral Disinfectant Cleaner from Mark here in town. We've been using it for years, and this is supposed to be very good at cleaning surfaces, especially if there is a COVID-19 virus on a surface. So that will be available to everyone. All right. And the last thing I kind of want to share is local public health recommendations for screening, exclusion, and readmittance of ill students and staff of COVID-19 in schools. So if your student or someone in your family has tested positive or has been exposed, we'll probably send this home, and this kind of gives guidance on readmittance to school. Symptomatic staff student who tests positive, or if they test negative, or if they don't get tested but they show symptoms, or if they test positive asymptomatic. And then we're working with East Central District Health and doctors on contact of contact, and what does that mean as well. So I don't know if I'm still sharing my screen or not. I'm probably not, am I? Okay. So let me do that here again real quick. So this is the document that I was just talking about. It's kind of the protocol on the symptomatic and testing positive that will go home. The document with the hand sanitizer will look like this, with all the chemicals that are in that. So parents have that information, as well as all the chemicals that are involved in our disinfectant when we clean our classrooms, our desks, and other surfaces. Okay. I'm going to stop there, and we're going to I'm going to look at my my list of questions, and we're going to, so again, if you have questions, please post them so we can see them, and then I'll try to answer them. And if it has something to do with, I don't want to play the medical doctor, we have experts online for that, and we'll have Dr. Lemke and Dr. Anderson answer those questions. So before we get started, Dr. Lemke, Dr. Anderson, any other comments?
I would probably add I think the one step that I think Kip and I can add, and I know the medical community as a whole, I will tell you, has been so unified on this. It's we said that early on in this situation, between pediatrics and the two family practice groups, and then the hospital. If your child is sick and is sent home, what do you do then? What's my next step? Walks to the door, has a fever. I think we would all agree that we are committed to helping the schools continue to keep safety, but also help parents navigate that next step through what do I do with the child who I think may have it. So I would say you're told to send home. The first step is to call your physician, get in contact with the office. I think we're all aware that there's going to be a potentially higher volume of calls coming up for these situations. We prepared for it with the packing industry, and I think responded well as a unified voice. And I think all of the offices are ready to take that volume of calls and to help people navigate whether they should be tested or not, and hopefully be able to even have more ready testing available. We're working, I know, on getting more ready tests available so that people can get that answer that they want. And I just want to throw in one other quick point about that. If a person is contacted or is in contact with somebody positive, and they are asked to quarantine, you can't test your way out of a positive or out of a contact. In other words, even if you get a negative test, that doesn't mean that necessarily the quarantine is over. And so I think East Central has been really diligent about that. A negative test doesn't mean necessarily that the quarantine is over. So, but just to say that I think all of the local providers here are very committed to helping kind of in a very, very timely fashion, help people kind of navigate what's the next step to that when I get sent home, et cetera.
Okay. Dr. Anderson, anything?
No, I just add that, we realize these quarantines and the advice you get from the health department and from your physician on these things can be kind of tough pills to swallow at times. And there's going to be some heartbreak involved in being told you need to be at home, but that's just where we're at right now. And this will pass.
Yeah, and I think you're exactly right. I know, Dr. Anderson, you talked about being that kid that only missed one day of school, and for some kids with their activities and stuff, we need more like you. Only missed one day in 12 years, 13 years.
I might have been exaggerating.
But no, seriously, you're exactly right. There's going to be some tough times and some tough decisions, and people aren't going to be happy with some of the things that either their local physician tells them they have to do, or even the school district to protect others. And again, we're just asking for grace and patience as we work through this, because we don't want it to spread and get out of control to where we can't have anything. And I know the mask thing is a very controversial thing. But I'll tell you, if we don't have the masks in place as a school district for both staff and students, we go right to red and we're in remote learning. And I think even though our staff did a great job last spring with the hand that was dealt to them, it's just not the same as in-person instruction. And so the longer we can keep our kids in the classroom, getting that face-to-face instruction, I know the education's better. So we want to continue to do that. So the first question is, what if my child doesn't keep the mask on, keeps messing with it? There's a lot that goes into keeping the mask clean, not touching the outside of it, etc. Hands have to be washed if the outside is touched, because that is a contaminant. How will you ensure that? Well, we can't ensure that they won't touch their masks. I can tell you, if I had my mask on right now, I'd have touched it probably 30 times, if not more, just trying to keep it up while I talk. They are going to have to adjust them, and I'll leave it up to one of the doctors to talk about as far as contamination. I think as long as they're not sharing their mask and swapping masks and everything else and keeping it to themselves, I think everything's okay.
Yeah, there was I think the original thought was, if I have my mask on, I'm protecting you. We now have data to say that actually the person wearing the mask gets some protection as well too. So it is a double benefit. So if I have COVID-19 and I'm coughing, most of that is probably contained within the fibers of the mask. So that's probably going to be a given. But if both people are wearing masks, there again, the benefit of that is both people are shedding less. So yeah, it's not perfect. We all can't wear N95s around, which protects both. But I think the benefit of even a simple face covering and cloth is still been shown. And so, I think washing those on a nightly basis is a good idea. I don't think it's a bad idea for those people washing those masks to maybe wear a glove while they're doing it, or at least wash your hands after you do it. So just simple things that we don't think about. I think, just being really make it a habit, make it a process that you go through, come home, put the mask in a certain area, you throw that in the washing machine right away. The good news about this virus is it does die very quickly with soap. It is very, there's a layer around it that just goes away and takes away its armor with soap and water. So, and that includes detergent. So that's the one good thing about it. And so just some simple techniques of what to do with those masks when they come home. I think is really becomes a habit that should be taken all year long.
All right, very good. Thank you. Social distancing question. In the classroom, are the desks 6 feet apart? I have not measured all the desks, but I know we're getting them as far apart as we can to spread the students out. Again, we do know, and what we've been told in our guidance, if both are masked up, and like the example that Dr. Anderson talked about with the hairdresser cutting the hair and not exposing the clients, as long as we're both masked up, and when our students walk in, they're doing the hand sanitizer. When they walk out, they're hand sanitizing, and we're wiping down the surfaces. We're able to bring the students closer together. Now, we're not going to be sitting side by side, shoulder to shoulder, but we can bring them within to that 3 feet, that 3 feet range from that standpoint. And are children allowed to interact like normal, or do they have to stay 6 feet from each other at all times? And I think that goes back to the first question is, as long as they're both masked up, I think they can have a conversation and they can play or do whatever. I think it's not going to guarantee 100% that nothing's going to happen, but we've mitigated the process through the sanitation and the universal precautions and the masks to do the best we can. But we want them to act like kids too. We don't want them to be, like they're wrapped in bubble wrap and they can't do some things. Will there be band, or what will band and choir look like? Yes, there will be band. There will be choir. I know Mr. Peabody, Mrs. Ditter, Mr. Ritter, and oh my gosh, I'm on Facebook Live and I can't think of my middle school band teacher's name. But anyway, yes, we will have band. We will have choir. They are working hard to make that happen in small groups. And there are some things that they're going to have to do for precautions as well. But I know they've been working hard on it because they want those kids in the classroom, and they want them participating in those activities. They're just good for kids, and a lot of kids really are successful and do very well in those programs. And we want to make sure that they can do that. If we can have football and volleyball and some of these other sports, we can have band and we can have choir. We just have to make sure we're doing it the right way and following the rules. How we know our students teacher without open house, as they are not listed on the bottom of the report cards from last year. We didn't put them on the bottom of the report cards because of the switch over to Synergy. You'll be getting information from your building principal here in the next week. I know by this time you usually know who your teacher is, and you had your packet of information at your front doorstep after the first of the month in August. But again, we moved school back 2 weeks. We're trying to hold off as long as we can so we get the right information to you in the amount of time that we have left, and the most current protocols and practices that we have in place for students. So those will be coming out shortly if they haven't already left today. How do we get supplies now from our online order without an open house? So many of you did the online order system. As one thing, we tried that for the first time this year, and those boxes with their supplies, so each student's supplies are boxed separately, and they'll be sitting on the student's desk. So when they come to school that first day, their box of supplies will be sitting on their desk. Why no morning walk? when we're in an era trying to diminish the amount of contact and trying to control movement of kids in hallways, in PE, in our classrooms, it just didn't make sense to have the morning walk to start the school year. I think this will probably be true in a lot of the answers we have here. We just need a good, 2 weeks to, it could be 2 months before we get really good at what we're doing, and trying to work through some of the issues that we think of everything we have to do and we're ready for everything, but I know there's going to be something that we're going to have to adjust. And we just think that not having the morning walk will help us as far as contact with students, because we can't really control that movement of the students or control what they're doing if they're around on the other side of the playground. So bear with us. We're going to reevaluate everything at the end of October. By November 1st, we may be having it again if the weather's good. But we're going to start the first couple of months pretty tight and pretty closed down as far as the school is concerned. How will the attendance policy be affected if and when a student or close contact of a student tests positive for COVID? I assume the self-quarantine expectation will be in place, but that will require missed days of school. If you are in self-quarantine or if you have tested positive for COVID, my guess is you've already seen your family physician. All we ask is that you get the documentation. It's not going to count against their attendance. And remember, absence is an absence. It doesn't matter if it's a hospitalization or a trip to Cancun. But when we count the absences for I shouldn't say skipping school, but when you start counting absences versus excused versus unexcused, medical documentation does not get counted in that. So just know that if we have notes from the doctor, East Central, or whoever you're working with, some kind of documentation there, those will not count against the student. When does school stuff like class schedules, transportation papers, lunch fees, computer fees start arriving for high schoolers? Those will be coming out. I think they were going to be mailed out this week. And again, going back to the previous question, we're starting a little bit later because we wanted to make sure all of our information was up to date and correct. And so you should be receiving those shortly. When should we get our flu shot, doctors? That's the next question.
As soon as it's available.
What's the time frame on that? Usually September, October? Does that sound right?
We haven't gotten
I
any.
think mid-September, early October.
Okay.
We're hoping to get a shipment in by August. So they used to say you only had to get it so late in the course it wouldn't last the whole year. That really isn't true anymore. These vaccines will last for the entire flu year. So sooner the better.
So can you guys walk us through, because I know a lot of people are going to be wondering, geez, do I have symptoms or do I not have symptoms? Because, like for myself, I have severe fall allergies, watery eyes, sore throat, all those pieces. How can we help our families and our students work through that process? I mean, obviously, I think in this time, we want them to contact you guys in your offices, irregardless, because it could be a symptom of COVID-19. But maybe walk us through that process of families coming to you thinking it may be an allergy or the flu or even COVID-19.
Well, sneezing is really not a very prevalent symptom with COVID. So, whereas it's very common with allergies. So that would be a good place to start. If you're not running a fever, but you got that tickle in your throat and you're sneezing, and you're probably more likely that it's allergies. But I guess the best advice we can give you is, when in doubt, you ask. We're happy to help out.
One of the things that we've instituted along with remote learning is, more telemedicine type visits. We're hopeful that there'll be some more delineation on what that looks like going forward. But I mean, it's going to be a part of our, so you may be asked to contact, and they may contact you via a telemedicine visit. And partially the reason there is to protect our clinic staff and personnel from potentially being exposed to a known COVID patient. So, but as I said, we're prepared to kind of handle some more phone calls. about that. So I guess question, Troy, documentation of a student's absence, and realizing that there's going to be quite a bit of that. How will there be a form to be filled out, or will there be a area on the website that we could go to for the physician's offices to do that, so they wouldn't necessarily have to come by the office and pick something up, and kind of limit the traffic in and out of the offices?
That's a great question. I think we could probably work something out like that online, whether it's through a Google form or whatever it happens to be, where we can document that. So let us work on that. That's a great suggestion. I appreciate the idea, because again, the foot traffic, in the medical facilities with everything else going on, I know is a lot of stress on you guys. But again, we want to make sure that, students, if they are sick or family members are sick, that they are seeing you, and that kind of gives us some assurance that they're receiving medical attention as well. So let us work on our end and see if we can't put something together that we can send out to your offices to verify that maybe a student's been in your office for this or has taken a test or symptomatic. Good suggestion. And so I owe my middle school band teacher a huge apology. And I think I don't know if he drinks Dr. Pepper or Diet Coke or whatever, but I think I owe him one. But sorry about that, Mr. Klee. I should know this because my sons were drummers and they took lessons from him for I don't know how many years. I spent a lot of money at your house. So I apologize for forgetting your name. So, but again, going back to band and music, I think anytime we can get our students involved in activities in a safe way, a lot of kids really thrive in those programs. But we got to make sure they're safe in the classroom first. And then again, I know some kids are going to have some medical issues as the year goes, and we're going to work through those both with the families, the doctors, East Central, to make sure that we're doing the right things for each and every one of them. So, gentlemen, I don't have any more questions. Oh, okay, maybe here we go. Okay, so a couple more questions here real quick, then we'll close it down. How do we enroll in the after-school program? The after-school program will be sending out information on that through the school mailing. I do believe that they're going to have the sign up on the 25th of August after school. So be looking in the mail for that. Okay, then information will also be posted tomorrow regarding how to enroll. But I know the open enrollment is going to start the 25th. Question is, what about diamonds and cheerleaders? Will they perform? Absolutely. If they're healthy and they can perform, they're going to perform. We want them out there supporting all of our activities. But you know what? I love watching them. I love watching the diamonds and the cheer team do what they do best and help and support the overall culture of our school. So yes, they will be able to perform and have their practices. I think that is about it. So, Docs, I'll give you one last shot of anything you want to say and leave our guests online here, and then we'll close it down.
I guess I would tell your parents or your students the same thing I kind of told our office staff when this whole thing kind of started, is that if you're going to get COVID, it's probably not going to be at work, because it's in the forefront of our mind there, where everybody's wearing protection, we're taking all the precautions, and it's when you're out and about on the weekend or doing your own thing or going shopping or whatever, that's when your risk is probably the highest. And we realize we got lots of kids in a fairly tight, space in school, but I truly believe that your children are going to be about as safe there as they can be with the use of all the precautions that are in place. So I hope that's somewhat reassuring.
Thank you, Dr. Anderson.
Yeah, I would agree. I think there's one thing that may be even worse than COVID, and that's fear of COVID and what that can do to people's mental psyche. But I think that we can really approach things and everything we've been talking about with mass, distance, and washing really reduces that fear to a very low level. And I know Dr. Anderson would probably agree. When I see somebody with my mask on and I wash my hands and I keep my distance, I have very, very little fear of developing COVID at all. And, you know, we're old enough where, sure, we don't want to test the waters with it, but all of this that we're talked about tonight is to reduce the fear in the kids, in the parents, and everybody. And if we all come together, I think our level of fear goes down significantly, and we don't have to live in the fear of getting it because we've done all the right things. And just as the example of the hairdressers, you know, we don't have to live in that fear. Am I going to get it? If we all kind of play by some of the simple rules.
Absolutely. And, you know, all of you, both of you have had children go through the school system. And I know that if it hasn't been COVID, it might've been something else where maybe caused that fear of sending your children to school. You know, I have two children at the high school as of right now, and I'm excited for them to start the school year. I'm also, we're not living in the fear bucket. But I understand why people think that way, and so we don't want to diminish that. We want to reach out and help you and assist you and your families. If I didn't think Columbus Public Schools wasn't the safest place, my own children would probably stay home as well. So we encourage you to give us an opportunity and a chance, and we'll see where the road takes us over the next couple 3 months. Someone asked when the end criteria for this is, if there is one. And, you know, I don't know. It's docs, have you got a secret vaccine or have any inside information for us on a vaccine?
No secret information. This ends when the virus doesn't have anywhere else to go. And what that means is that the virus needs a host. And if enough of the people either have natural immunity or vaccine acquired immunity, and that doesn't have to be 100%, by the way. So we don't have to have 100% vaccination. We don't have to have 100% of what we call herd immunity. It depends upon what the infection rate of the different areas are, but it may only need 30 to 40% of the people to be have immunity in order to that. It's kind of like control rods in a nuclear reactor. You get enough of those, or a fire break in a fire. If you get enough of that, then the virus has nowhere to go, and it dies out. And that's how it's going to end. And that's when this stops, is when there is, you know, maybe 30 to 40 to 50% of the people that have that immunity that we need. Then the virus has nowhere else to go, and then it goes away. So, and I think that's a very reachable goal to get to in a, you know, maybe shorter time than we thought.
Okay. All right. How will sport events work? Mask mandatory. We have ordered the pull-up things that come up over the athlete's face and nose. So if they are not in the contest, they'll have them on at all time there, so they won't take them on and off. But they'll have them on when they're not in the contest. They'll have to pull them up and wear them. And I think a lot of your college athletes and our Heartland Athletic Conference teams are all ordering they call them the Gators, to pull up over. So you'll see them pretty prevalent in all of our sports activities. Homecoming dance, you know, one of the worst decisions we've ever had to make was about prom for last year and not having that. So we're going to take homecoming dance. We're going to look at it. We'll see where we're at as a community. I'm not going to make any promises, but we're going to do everything in our power to maybe pull that off. But like I said, you, families, and the community really have to help us out. And like Dr. Lemke and Dr. Anderson said, the only way to diminish this is to have no place for the host to continue to grow. And so I think if we can see our numbers down, we can see the risk dial get down to green and start, you know, doing some things that we need to do to lower the risk for our community. I think, yeah, it could be on the horizon. It may be later in the season, or it might be a winter homecoming. I don't know, but we'll try to have something. I can promise you that the high school staff will do everything in their power to see if we can't get that done, working with East Central and the local doctors. Will they be allowed to play together at recess? Yes, they'll be able to play together at recess. Again, it's going to be a teachable moment in all of our elementary classrooms. on how we interact on the playground and what we need to do. There's going to be a lot of social emotional training with our students. With the proximity and the social distancing, we're going to have to do a lot of teaching every single day. And we want our kids out in recess. We want them out running. We want them out getting physical exercise, and we want them interacting. And so we've talked about group play. We've got our kindergarten teachers are working on, the group play areas that they have in the kindergarten classrooms, or even our preschool classrooms. And what does that look like? Are there separate play stations, and the child stays at those stations all week, and then we sanitize the equipment? So they're working through those things. Again, we want to try to make it as normal as possible, but please understand that we do have to think differently in this whole process. And we want to, like I said, we want to make sure that the educational process is as normal as possible, but we know we're going to have to make some changes in how we do things as well. Will parents be notified if their child has been in contact with someone who has COVID? Absolutely. We will do the contact tracing, and we will make sure that messages get out to those parents. What are you going to do if some of the kids refuse to wear their masks, high schoolers? Well, I think Dr. Plaus in his article in Lakeview and their plan said it best. I think it's a teachable moment on wearing the masks. We've heard the doctors today talk about, it's not just about protecting them, it's protecting everyone around you as well. And we're just going to have to work with families, or have to work with the student and develop a plan on what we can do to ensure that student wears the mask and keeps everybody else safe. The last thing you want to do is get into the discipline piece of it. So again, we're asking families to help us in that process, and hopefully I'm not saying we'll never come into that predicament, but I imagine if we do, that we're going to work together to find a solution. During PE and recess, do the kids have to wear masks? If they're doing physical exertion and they're keeping space, we're going to say no. They don't have to wear the mask, but if they're in close contact with each other within that 6 feet, we're going to say yes, they have to wear them. Our PE teachers are working on their curriculum and how can we make this work in our classrooms. Again, we're hoping to get through the first semester and there's a vaccine or there's something out there that says we can go back to some of our normal procedures. It's going to be a long 3 months, but we ask for your patience. Like I said, patience and grace, because it will look and feel a little bit different, and it just won't look as normal as it did. But we're going to try to ensure that it happens to our best ability. I don't know what else to say. That you just, like I said, just bear with us, and the mask breaks, and all the other processes. We're just gonna have to work through that and develop plans as we go. And like I said, I think we got a pretty good plan right now with the masks and how that works. But we have to look within each one of our classrooms, like PE and band and choir, and make sure it works for everybody. All right, gentlemen. Dr. Anderson, Dr. Lemke, thank you for joining us. I kept you 8 minutes longer than I promised you. So I appreciate your time this evening and helping us get information out to our parents and families. Again, as Columbus High alumni, I know you guys are proud to be Columbus High graduates, and I thank you from Columbus Public Schools.
Thank you.
Go Maroon.
That's right. Wear your maroon proudly.
I'm just glad you didn't make us. I'm just glad you didn't make Kip and I sing the fight song, because we couldn't do it.
Well, I wasn't even going to tell them what year you graduated. So, all right. Well, thanks, gentlemen, and we're going to end our Facebook Live. Thank you very much.